Bismillahirrahmanirrahim. This is the safest one can feel in Pakistan today. Thank you very much, all my friends here. Some people that I've loved all my life are under this roof. The talk that I have for you is primarily to not zoom into the coronary artery, but to try and zoom out of it. You're all used to looking at it in all sorts of details and then planting stents into it. So let's get out of that word for a few minutes, about 10 minutes or so, and then see, can we look at coronary artery disease slightly differently? I was sitting there and reflecting on why should Pakistan have high mortality rates? Why should Pakistan be number one in diabetes? With so many people wanting to die. Can you think of why would somebody like to die? I had a friend who was standing with me. उसने कहा कि यार वो ज़रा मैं cigarette ले लूँ, and he went and he bought a cigarette. While he was pointing to the gentleman who was selling the cigarette, he said कि वो जिसके ऊपर गंदी सी तस्वीर बनी हुई है वो वाली cigarette दे दे. And you know that गंदी सी तस्वीर is of the cancer of the mouth, actually. So he was pointing at, using it as a pointer. So here is this death instinct that people in Pakistan have, and you need to think about it. Why do we want to kill ourselves? Maybe life is not worth living anymore. Is that a reason? दिल ही तो है न संगो खिश्त, दर्द से भर न आए क्यों, रोएंगे हम हजार बार, कोई हमें मनाए क्यों? Maybe we've made life so impossible for human beings, so not worth living anymore, that it doesn't really matter whether I live for 10 years, 20, 30, 40 or 50. That's a question that you can ask only if you zoom out from the word of cardiology and get into the word of philosophy and spirituality a little bit. And I'll try and connect these two concepts with you during the course of my discussion with you. Now, the issue that I plan to sort of relate my discussion with is stress. And for that, you would have to understand that a certain degree and certain amount of stress is absolutely crucial for human beings. And if we did not have stress, probably we would not be alive. One of the reasons why we've done so well over the last couple of millions of years on this planet is that we have handled challenges much better than other species. So therefore, an optimum stress is very, very good. And it's very important to be stressful. And some people just generically use, stress khatam kar lein apni zindagi mein se, aap khush raha karen. कितना खुश रहा जा सकता है इस माहौल में जिसमें हम रहते हैं? It's an important question to ask. Is gloom all that bad? No, sir. Actually, a certain degree of distress is important to reverse a situation. If you would not feel distressed, you will never change anything. But what we need to dread is the coronary artery disease part of it, and that's dangerous. But everything that happens before that is reversible and can be used effectively, importantly, and productively. Now, for that, you would have to first of all understand that human beings are not about heart only. We are a very emotional being in this world. Probably human beings now are known to experience 72 different types of emotions. There's no other species in the world, including as big a thing as whale, as large a thing as an elephant, who can experience more number of emotions. And I've just listed a few that may influence you. So when you're looking at people with hypertension, when you're looking at people with heart failures, one of the things to zoom out is to look at them and see on their faces any of these emotions. Faces betray emotions beautifully, and eyes do that even better. तुम इतना जो मुस्कुरा रहे हो, वो क्या है गम जो छुपा रहे हो? So it's important sometimes to not look at or stop looking at the echo and start looking at the person जिसका echo हो रहा है. So go beyond the chest a little bit and reach up and stare onto the face of the patient that you are doing the echo of. And that's important sometimes. And do you find any of these emotions on on the faces of your patients? If you do, you have successfully zoomed out of the word of coronary artery disease. Congratulations on doing that. And now, please see, in this person's life, is there any love? And for those of you who think that increased PNS is a typographical error, no, it is not. PNS here stands for parasympathetic nervous system. So it's not what you thought it was. So love is something that's grossly probably missing in the life of people. So one of the questions that you need to ask as a cardiologist, आप तो दिल वाले लोग हैं, कि एक तो वो दिल है ना जो यहाँ धड़कता है, किसी और का दिल आपके लिए धड़कता है या नहीं, is a question that you need to sometimes ask your patient. और क्या आपका दिल किसी और के लिए धड़कता है या नहीं? It's also a question worth asking, but that will only happen if you will zoom out. I can tell you that love is hugely protective, and I'll just show you in a while why and how. In terms of cardiac diseases, particularly coronary artery disease, the importance of love and affection versus all the rest that I've shown you a little above. And for that, I would introduce to you this concept of bioecology. Human beings respond, they're very sensitive, they respond to their environment. And you've heard the importance of noise, and you've heard the importance of environment, and how it forms the trigger of a genetic predisposition. For that, you would have to remember the concept of bioecology, that your coronary artery disease are responding to a lot of things. And for that, you would have to probably visit this concept of allostasis. How many in this hall have actually heard about this concept or read about it? Please raise hands. It's very sad. I'm glad that I used it. It's important. I'll just show you what it is. Just read through the definition of it. What happens in coronary artery disease actually starts to happen somewhere here, because the brain is the interface between the heart and the world out there. Stuck in this jail of the chest, heart cannot really reach out to what's happening around in the world. It is through the jailer or the eyes of the jailer, the brain, that the heart can actually look at the world differently. And this process by which heart relates itself and connects itself with that part of the body which shows what environment this heart is living in is the process of allostasis. And if this allostatic process becomes a load on you, that instead of bringing comfort, love, tender, and care to you, it becomes merciless around you, then the word around becomes such a load that it fails the allostasis and goes down and influences the coronary artery. And for that, you would have to understand that once the load starts to increase, the consequence is going to be the coronary artery disease that you see. So this is the term that I was referring to now, if you are able to read what allostasis is. It's a central control of all mechanisms of the body. The centralized control of homeostasis is what allostasis is. And what I was referring to you earlier was allostatic load. When life becomes impossible, the allostatic load keeps increasing. I don't know how you felt on the 9th May, but many of us had a huge load on our hearts on that day. And that's what I'm referring to. Or just during it. And since then, has your load increased or reduced? How would it impact on your coronary artery disease? Would, however, or coronary arteries probably start to appear maybe a couple of years from now. But keep in mind that things happen much earlier than when they appear to your naked eye. Now, the two areas that are involved in allostatic load development are the prefrontal cortex of the brain and these areas that I've highlighted to you. Hippocampus, which provides the memory to you. Your basal ganglia, with which you approach and love human beings and other things that are beautiful around you. And the amygdala that scares and puts you in a state of anger and frustration. So if you are living in a world that only triggers your amygdala, then you're going to stimulate your sympathetic nervous system only, or predominantly, and that is going to influence, and I'll show you how it will influence in a minute, everything that is down there in the cage called the chest. Now, people think, please focus on the yellow part a little more. People think that there's more flow coming from the brain to everything else that's down there. The story is actually the opposite. A lot goes from the heart and the intestines and everything else that it is supplying to the brain. 3 times more. There's more that goes back than that comes back. So it is this vagus nerve, good old vagabond that we have in our bodies, that actually sort of connects whatever happens around to the hearts. And this is how it happens. All the major life events, and that's what I was referring to 9th May, all the other traumas and abuses that you and I go through on the roadside every day when somebody stops you for nothing and insults you, taxes your coronary artery. And how it does that is what is shown here for you. And you can read this probably much better than I. It disrupts just not your homeostasis, it disrupts your brain, your allostatic mechanisms, increases your allostatic load. And it is that lack of handling of the coronary artery disease effectively that would produce coronary artery disease in them. This shift from eustress to eventually a disease that you call coronary artery disease. And of course, smoking and alcohol and inactivity must never be forgotten, that there is a phenomenon called hopelessness that has the same impact on human beings and everything else that you've discussed so far since morning. Hopelessness. And maybe that is the reason why people are wanting to develop diabetes and coronary artery diseases, is a thought that you need to keep in mind. And for that, I would suggest that when you look at people's diastolic blood pressures, also consider that their life also needs to be preventively having 2 phases. A diastolic phase in which they can become reflective about the world inside, what happens within them on a daily basis, and are able to be mindful of the world they live in, are able to meditate, reflect, and able to sleep better. But their life also needs to have a systolic component. So your life is also diastolic and systolic. But kahin aisa to nahi hai कि you sometimes have a patient who has a high output failure of life, or a high or a low output failure in life. That's an important question that you need to ask, but that for that you would have to zoom out from the patient's coronary artery disease. This is a good question to ask about all your patients. But it will only happen if you look at diastolic and systolic differently. But it is also a question, ladies and gentlemen, that you may ask yourself. Thank you very much.